Thank you very much for that question, Ron. In reflecting on his question as to, how can we ensure, that there be a stronger voice, for the First Peoples. And I think one of the challenges we have to overcome is the marginalization of a people that we're not necessarily a part of the decision-making processes decide, for us what is good for us. What I'm very proud to, to say that here in our area, in our region, we were able to develop a partnership with the local regional authority, and it took a lot of work. It took a lot of sharing, sometimes crying, but, we persevered in terms of, ensuring that we would have equal participation in the process of the local hospital. And in that understanding of equal participation is recognizing that we have to establish partnerships. And we were very fortunate that we had our partners with the Regional Health Authority that were open, to embarking on this journey, that we would accept, first of all, the unified responsibility that we have to work together to ensure that the patients of the hospital would be given maximum support, to help create greater support for their health and wellness. So I would suggest, here that in responding to that question is that you have to put, the First Peoples in a position of partnership minimum, that they be recognized for their autonomy, their independence in terms of being able to be a part of the decision-making process that concerns, not only Indigenous people, but I would say everyone, that it's going to take leadership on both sides, on the side of Indigenous people and certainly on the sides of Western approaches that are represented by regional health authorities or by the government themselves. It's going to take people that are willing to sit down and to engage in discussion based on values of respect, that we will be open, to ensure that we can create a health system that is second to none. And here we have in our area with what we established in that partnership, is our equal participation in that hospital that we refer to as Kigegamik. Translated, it means a place of healing. And we have had, really very good support within the hospital itself with their administrators, and certainly at a higher level, that were very open to developing this relationship. And we find today that, yes, we have a lot more work to do, but I think that we've made that step, to gain that recognition that we must have and be in a position of equal partnership in the decision making in regards to, how we see what could best support the health and wellness of our people. And certainly there is a lot of challenges. We recognize that, but the leadership is what is most important. And what really made the leadership or the existence of Kigegamik was led by the knowledge keepers of our communities. We ensured that the local political authorities, through resolution, gave the full autonomy to the elders to lead the whole process, in that hospital, that we would have a strong voice. And we have people today that we have firsthand information, what is happening in the hospital. We're not getting secondhand. We're getting firsthand what is happening in the hospital in terms of the challenges. And what is so wonderful about our approach is that we're dealing with as partners, having a collective responsibility, to creating a better healthcare system. And part of the responsibility on our part, we felt, was to educate, the healthcare workers within that institution, to make them aware of who we are, why we think the way we do, and how we rely on traditional methods, to help in the healing process of our people. So I would encourage, for those that are listening across the country, to maybe come and visit us, and we would be more than willing to share. And I know that the local regional health authority here in this area have been very, very supportive, have been very cooperative in terms of our autonomy and independence, in ensuring that we have a much stronger voice. And to me, it's been my experience in my life that change will not happen through conflict. It will not happen through confrontation. It's going to happen through the hearts of people that are willing to have the courage to make the changes that are necessary. And we have those people, that have stepped forward here in this area. And I know that, we've set the stage, and maybe there's others across the country that have done similar things, and it is to the greater benefit, for those that are in need of full support for their wellness. Thank you, Miguel.